I'm talking today to Stephen Brown. Stephen is a certified Rolfer. Hi, Stephen. How are you?
Hi, Joanne.
Stephen, we've spoken a little bit about Rolfing before. We're going to talk today about Laser Assisted Rolfing. Tell me, what is Laser Assisted Rolfing?
Okay. Well, first of all, I'll show you the laser. This is a very unique laser, and I believe I'm the only one in Israel that has it. It's programmable, and it treats many, many, many different things. Very unique laser. So laser-assisted Rolfing, really, to me, all my studies really start with observations and questions, and to see how I can do better. I'm always interested in learning and growing my scope of knowledge. So when we're doing Rolfing, we're affecting the outer structure, but it also affects the inner physiology. And I was looking for a bridge. How do I connect structure and physiology? And then I started to hear about the laser, and how the laser affects the cells and how it affects the nerves. And so literally without even seeing the laser, I just had an instinct, and I flew off to Phoenix, Arizona, and I went and studied the laser, and the results I saw were absolutely astounding. And the first I saw it on myself. My teacher, I was used as a model, and I had this injury that had been bothering me for months. Every morning I'd wake up in pain, and my teacher lasered it and also did some manipulation with his hands. And within 5 minutes it was gone, never came back. Well, I was sold. I bought the laser and I started to use it. And one of the first patients I used it on was a guy that had fallen down, and he had hurt his arm, his deltoid specifically, and I did some basic neurological testing, and this big, strong guy had no power to his deltoid. The nerve had literally shut off. So as instructed, I lasered. There are actually 4 lasers that I use at the same time. I lasered his deltoid and the nerve root, which comes from C5, C6 in his neck. Literally within 120 seconds, the electricity turned back on, and I couldn't budge his arm after that. And I just scratched my head, and I said, this is absolutely incredible. So the nerves are what gives our muscles and our organs its energy supply, among other things. And so if we're not getting a good nerve conduction, the muscles are going to be weak. And muscles are the primary stabilizers of joints in the body. So if the muscle's weak, if the nerve is weak and the muscle's weak, and then the joint is going to be predisposed to injury. So that's not good. So the laser can literally turn the electricity back on, just like an outlet. The fuse box is turned off, we turn the fuse back on, and it's amazing how quickly that happens. But another application that I use with the laser with Rolfing is doing nerve work. Many times what happens is nerves can become chronically inflamed, not just acutely inflamed in the beginning, but then there's this insidious process that can happen where nerves can become chronically inflamed. And through the laser work and gentle working with the nerves, we get the nerve to normalize. So instead of it having the texture of like a pipe cleaner, it then takes on the normal texture of like a piece of dental floss, which means it rolls and glides, and there's good nerve conduction. So that's the one of the major reasons why I started to use laser therapy. However, there are many applications, and over the past several years, I've actually been treating neurological disorders as well, such as Parkinsons and MS. And I was involved in many studies with neurological disorders, and that's laser therapy to different areas of the brain, right? Very different than the muscle or nerve work. This is actually lasering the brain, and lasering the brain sounds scary, doesn't it? I should point out that this is low-level laser. It is completely non-invasive. You don't even feel it. And there's no danger involved. And it actually has FDA approval as a non-invasive device. Okay, so that's important to know. But I actually was the chief practitioner and in charge of research and development at a major center here in Jerusalem treating neurological disorders. So we've seen a lot of improvement with neurological disorders, like I said, Parkinson's and MS and so forth.
What specific conditions can you treat with the laser Rolfing? You've said Parkinson's, for example, for neurological. For the non-neurological, what specific conditions?
Okay, so any type of injury. I'll give you an example of another reason why I started using the laser. I was treating a patient who had a shoulder injury, and I was really doing my best work. And I got her 90% of the way there. And then I figured out it wasn't the muscle, it wasn't the joint, it was the nerve that was inflamed. And I was limited to what I could do only with my hands. But when I started using the laser, I normalized that nerve. I got the inflammation of the nerve down, which is the source of a lot of our aches and pains. So really any ache, pain that has to do with muscles and nerves can be treated by the laser, including back pain. It has FDA approval that it proves that it helps carpal tunnel syndrome. Also, I have a lot of experience with post-surgical procedures and broken bones. I've treated many broken bones. Just lasering, it helps the healing time incredibly. Cut down in half.
And is the process painful? Is the laser painful?
You don't even feel it. You don't even feel it. You lie there completely relaxed, and it cannot be felt. It's low level laser. You don't feel it.
And how many sessions do people normally need? And what happens when they are finished the sessions of laser Rolfing? Will they need to come back to you once or twice?
Okay, that's a good question. It depends on what's going on. Like I said earlier, with the person with the injured deltoid, within a minute and a half, the problem was fixed. And he still came back for other work. So it really depends on the situation. Usually I use the laser within the context of Rolfing as an excellent assistive tool. So for the 10 sessions or 13 sessions, however many it takes, the laser is usually on while I'm working. And the difference between just working with my hands and laser-assisted Rolfing is usually quite profound.
Thank you, Stephen. Thank you so much for talking to me today.
Thank you so much. You have a great day. Again, I want